Welcome back. March is also Kidney Disease Awareness Month. And right now we're going to talk about chronic kidney disease. Joining us virtually is Kathleen Belmonte, Chief Nursing Officer at Fresenius Healthcare. She is here, Kathleen, with us, as well as Maria Jimenez, who is a kidney transplant survivor and advocate. We're so grateful they're both with us today. Kathleen, tell me more about chronic kidney disease.
Absolutely. And thanks, Christine, so much for having us today. Happy National Kidney Awareness Month. So what is chronic kidney disease? So if you picture that the kidneys are your super organs, right? Their job is to filter waste, toxins, and fluid. They keep you healthy. They are incredibly important to your overall health and well-being. When someone has chronic kidney disease, their kidneys are not able to do that and not able to do that effectively. So there are 5 stages to chronic kidney disease. Stage 1, early in diagnosis. So your kidneys are damaged or slightly damaged, all the way to stage 5 and then end stage renal disease. So very important to keep your kidneys healthy. Most people are asymptomatic in the earlier stages of CKD. So if you think about stages 3 into stage 4, many people don't have any symptoms of chronic kidney disease. When you start to get into later stages of chronic kidney disease, Christine, you will see that people will experience symptoms like swelling and fluid in their hands and their feet, fatigue, headaches, nausea. Those are common symptoms that people experience in the advanced stages of CKD.
It is very concerning, especially since it sounds like the symptoms don't appear until you're in advanced stages. What are the risk factors, and are there any early warning signs?
Yeah, absolutely. That is a terrific question. So there are risk factors. So conditions that put individuals at risk for chronic kidney disease. The leading causes of chronic kidney disease are diabetes and high blood pressure. So huge risk factors. 75% of CKD is driven by people who have those underlying disease states. So as you can imagine, if you have diabetes, if you have high blood pressure, very, very important to control both your blood sugar and your blood pressure, but also incredibly important if you have those risk factors to be routinely screened for chronic kidney disease. Now, other risk factors include things like being of an older age. So people over the age of 60 are at an increased risk. Also, people who have a family history of chronic kidney disease or kidney failure are also at increased risk. Because, Christine, people are asymptomatic, very, very important that screening becomes part of an annual routine so you can make sure that your kidneys stay healthy.
So screening is very important for prevention. Anything else we can do to help prevent chronic kidney disease?
Yes, so early detection is critical. So that means annually, if you are at higher risk, so some of those conditions I just mentioned, please make sure you're talking to your healthcare provider about getting screened annually. Something as simple as a blood test or a urine test can help you understand the health of your kidneys, but also can help you to keep your kidneys healthy so that you can understand if you have chronic kidney disease. It's a lot easier to proactively manage progression of kidney disease if you can identify it early, and if you can then implement, diet, exercise, medication interventions that help to control progression.
Maria, thanks so much for being here today as well, sharing your experiences with us. When did you realize that you were having issues with your kidneys?
Thank you, Christine. For me, it started when I was 23 years old. I did not know I had kidney disease. I just started experiencing a lot of the symptoms that Kathleen mentioned, from headaches to fatigue to shortness of breath, swelling in my hands and feet. So these symptoms only appeared 2 weeks prior to my diagnosis. I knew something was going on, I just didn't know what it was. I ended up in the ER they confirmed that I had a kidney failure, and they told me I needed to start dialysis right away. So I started dialysis in the hospital, and after discharge, I started a dialysis in a dialysis center, and it was really difficult for me, this transition, because I had to drop out of school. I had to stop work because of the dialysis treatments conflicting with my activities. So at this point, it was when my doctor and my care team encouraged me to consider home dialysis, as they felt this would be a lot more beneficial to my lifestyle. After a lot of encouragement from them and me being very, very hesitant, I decided to transition to home hemodialysis after 5 years of being in the clinic. I did home hemodialysis for about 4 years, and it was a life-changing experience. I started to feel better, more energy, my overall health improved, and also I was able to have much more flexibility in my schedule, which allowed me to return to work and return to school. After 4 years of home hemodialysis, in 2017, I was very fortunate and blessed to be able to receive a kidney transplant, and it's been working wonderful since then.
Maria, what made you decide to become an advocate for kidney issues and to share your story nationwide?
Yeah, absolutely. So it was that actual transition, going through those two modalities, going through in-center and then transitioning to home hemodialysis, was what inspired me to be able to advocate and share my story. I was encouraged by one of my nurses in the home program to be able to share my journey with other patients, with their family members, and I jumped right on it. I wanted it to be able to educate patients. I wanted to be able to share my story, and I was able to see patients transition from being diagnosed with chronic kidney disease to starting dialysis, and then transitioning into home dialysis. Being able to witness that is what really encouraged me every day. So I became a kidney care advocate with Fresenius Kidney Care, and on a day-to-day basis, I educate patients about their options. I educate patients about chronic kidney disease, and I share my story with them to be able to empower them and to encourage them.
And Kathleen, this is very important information. Where can we find out more?
Yeah, thanks so much, Christine. So absolutely. So a couple of things. If you or a loved one are at risk for CKD, please make sure you get screened at least once a year for chronic kidney disease. So those risk factors that we talked about, please do not wait to have symptoms before you get screened. So diabetes, high blood pressure, or a family history, make sure you work with your healthcare provider on that. We have some really, really, really great information about kidney disease and also options. You can go to Fresenius Kidney Care. That's FRESENIUS Kidney Care, all one word, .com. I know it's a mouthful, but there is great information, Christine, there about kidney disease and also about options around chronic kidney disease and end-stage renal failure.
Well, thank you so much, Kathleen and Maria, for joining us today. Really appreciate this information during National Kidney Awareness Month. Thanks so much for your time today. We'll be back right here on Mountain Connections right after this.